Hi everyone, my name is Sandra and I'm one of the pharmacists with Personalized Prescribing, and I'm really excited to walk you guys through our patient journey today. So if you're a client who is considering ordering our test or who has just ordered it, this video will be perfect for you because it'll really walk you guys through what our process is, how I interpret your genetic results, and what makes personalized prescribing's offering unique to all of the other genetic tests available on the market. So I'm going to start with just walking you through the logistics of our process. As soon as you've ordered the test online, you'll receive an email. That email will contain a link to our consent form. Very quick and simple. You fill it out, click submit. We automatically receive it on our end. There will also be my availability for phone appointment. This phone appointment is so important, and I really encourage you guys to respond to that. Let me know when you're available for a phone appointment, because during that appointment, it'll really give me an opportunity to ask you questions pertinent to your case. So, for example, do you have any allergies? What current medications are you taking? What medications have you tried in the past? Why did they or did they not work? Lifestyle factors. So things like marijuana usage or whether or not you're a smoker can really play into your response to medications, and also into your side effect risk. So as soon as you've sent the kit back to our lab, and by the way, it does come with instructions, very simple, very easy. Our lab will analyze the saliva for genes tested, and our lab director will then upload the genetic profile onto our proprietary software. And I'm actually really excited because I'm actually going to exit this presentation and walk you guys through the back end of our software and what it is that I do when I interpret your genetic results. So I'm just going to exit this presentation. And I'm already logged in, so that's excellent. And I'm going to take patient 590 for example's sake. So the first thing I would do is I would click Pharmacist Summary. And I'm actually going to filter for anxiety and depression because that's where most of our test orders come from. This just gives me a very general overview of what's going on with that client. And I'll explain exactly what I do. But before I do, I just want to quickly define what these different columns are so that you understand what I'm saying. So metabolism just refers to how you circulate these medications in your bloodstream by way of liver enzymes and also how you clear them out of your body. So it's just circulation and clearance. The blood-brain barrier. The blood-brain barrier is essentially a pump that exists between the brain and the blood, separates the brain and the blood, and it's also responsible for expelling any substance that the brain recognizes as foreign. It's meant to prevent the entry of foreign substances into the brain. So it so happens that antidepressants actually have a high attraction or affinity to this pump. So oftentimes, the antidepressant reaches the brain and then this blood-brain barrier just pushes the antidepressant back out into the rest of your body, especially if you have the genetic variant that refers to overactivity at the blood-brain barrier, which in this case, this patient actually does show increased clearance. So this can be problematic. And then there's efficacy. So efficacy is the most important thing here. Efficacy refers to how you actually respond at the level of the brain receptors themselves. And then side effects, interestingly, you don't only have serotonin receptors in your brain, you have them all over the body, mainly in the gut actually, which is why oftentimes people feel nauseous the first 2 weeks they start an antidepressant. Your body eventually does build tolerance. You also have serotonin receptors in your groin, which is why some people will experience decreased libido or sexual dysfunction. Most of these side effects do subside with time. They can, you can be at higher or lower risk depending on your genetic variants. So I'm going to start by just quickly analyzing patient 590's results. Okay, so I see green at response. So there's one medication this client responds to here, desvenlafaxine. I also see green at fluvoxamine. That's two medications, levomalnicipine, 3 medications, and then the last one I believe is venlafaxine. That's 4 medications. So just based off of looking at this, I would very quickly eliminate venlafaxine due to intermediate metabolism. So this patient clears this medication slightly slower than normal. It accumulates a little bit in their bloodstream, puts them at risk of side effects, and then they're also showing increased activity at the blood-brain barrier, meaning this medication reaches their brain and is likely very quickly pushed back out by the blood-brain barrier into the rest of their body. So if if the medication's not entering the brain in a sufficient concentration, then this response will likely also be blunted. So for the same reason, I'm going to eliminate the fluvoxamine we saw here. So that leaves us with 2 great options, the desvenlafaxine, where we're seeing mostly green all around, and then also the levomalnicipine, where we're also seeing a lot of green. So at this point, I would exit Pharmacist Summary. Let's go back to 590, and then I would click View Report. So this is where I get actual genetic details on the desvenlafaxine and the levomalnicipine, or on any of the drugs tested if I wish. So let's click desvenlafaxine. Okay. And then we actually test about 5 or 6 genes for the desvenlafaxine, and this client is showing 90% likelihood of response. So this is excellent. They have almost all of the genetic variants required at the different genes. So for DRD2, that's a dopamine receptor, they're getting a full score. HTR2A, serotonin receptor, TPH2, that's tryptophan, SLC6A2, that's the norepinephrine transporter. These are all crucial genes, and they're showing really good response. And then side effects, they're green as well. Worsened depression, that's also a side effect risk, also green. Fatigue, they're showing yellow, but that's not a huge issue. I don't know if you noticed, but there's no metabolism information here. Desvenlafaxine is actually cleared by the kidneys, so no liver enzyme information is necessary, and this drug also has known attraction to the blood-brain barrier. This is great news because this client had overactivity. So it looks so far like Prestige is a perfect fit. Let's take a look at the levomalnicipine. Okay, so also green and a score of 100%. So granted, we are testing less genes here, but this is still excellent response. Green for side effects, no risk of worsened anxiety. And then the same thing here. Levomalnicipine is cleared mainly by the kidneys, no liver enzyme information required, no known attraction to the blood-brain barrier. So it looks now like we have 2 medications that are a really good fit. At this point, the pharmacist would employ 2 things. The first thing they would employ is their knowledge of pharmacology and how these 2 different medications work. And they would couple that in with the information you shared in that initial phone appointment. So what is your diagnosis and what medication is more appropriate for that diagnosis? What have you tried in the past that hasn't worked? What medications are you taking in conjunction with an antidepressant that might affect response or metabolism of either of these medications? So just for example's sake, if this patient had a diagnosis of depression and ADD, I might select the levomalnicipine. Levomalnicipine is an SNRI medication, has both serotonin and norepinephrine activity, but it's the only SNRI that has a greater propensity for raising norepinephrine levels, noradrenaline in the brain, relative to serotonin. So noradrenaline is involved in the prefrontal cortex in neurocognitive function, focus, motivation, also involved in energy levels, very stimulating. If weight gain is a concern, I might go with the levomalnicipine. So the more noradrenaline you have, the more your rest and digest system is sort of suppressed and your appetite is suppressed. Whereas if the patient is saying, my main issue is I'm very anxious, but I'm also a little bit depressed, I might select the desvenlafaxine. So these are both SNRI medications, both technically indicated for the treatment of major depressive disorder, but desvenlafaxine could possibly be used off-label for anxiety because it actually has a greater propensity for raising serotonin versus norepinephrine. And serotonin is really great at neutralizing the mood and at treating anxiety disorders. So at this point, the pharmacist would really employ their knowledge of what you shared with them, and also their knowledge of pharmacology and how these 2 different medications work. So for example's sake, I'm going to recommend the levomalnicipine for this patient, and I'm just going to circle back to our slideshow. So we talked about all of this. Scroll back here. Okay, so in this case, I decided on the Levomalnicipine, but I also provided the desvenlafaxine as an alternative. I would then prepare the PDF report that I'm going to email you. I would, include a clear, concise recommendation, taper off of this medication, start levomilnicipran at 20 milligrams once daily, each morning, slowly titrated to effect. I would provide you with a summary of your general response to the most commonly prescribed antidepressants on the market, and I would also include a couple of paragraphs of rationale for your physician, but also for you. We would schedule a phone appointment when I email you these results. I would discuss them with you, break them down into terms that are easy to understand, and also, if you've provided me your consent, I would fax those results straight over to your physician. After that, I invite you to stay in touch with me so you or your physician can give me a call or send me an email, ask questions, schedule a phone appointment if you wish. I'm happy to walk you through how to taper off of the medication if you need a taper schedule, how to manage your side effects, and I'd ideally follow up with you through email just weekly or biweekly until you hit the 6 to 8 week mark on the new medication. And ideally, you'd be feeling good. And if you're not, I'm happy to explore the other medication you showed good response to or a moderate response to or help you to find alternatives. So this is not transactional. I will always be there to guide you through the process, to answer your medication related questions. You can call Personalized Prescribing 6 months later and ask a question about your medications. So it really is a lifelong service. This is a small summary of our patient journey. If you have any other questions, you are more than welcome to reach out to us at Personalized Prescribing. I hope you guys found this informative. Thank you.